have you ever checked your blood pressure, saw a number like 140/90, and immediately panicked because you were told anything above 120 is dangerous? Or maybe your doctor lowered your blood pressure medication and suddenly you started feeling weak, dizzy, or exhausted even though your numbers looked perfect on paper. Here's the truth that surprises many older adults. The best blood pressure after 60 is not always the same as the best blood pressure at 30, and this misunderstanding may be affecting millions of people right now. Some older adults are walking around with blood pressure that is dangerously high without realizing it. Others are being treated so aggressively that their blood pressure becomes too low, increasing the risk of falls, confusion, kidney problems, and even memory issues. The scary part is that many people believe they are doing everything right because they are only focused on hitting a specific number. But blood pressure is far more complicated than some people think. Your ideal range depends on your age, your medications, your heart health, your activity level, and even how stable you feel when you stand up and walk. In fact, two people with the exact same blood pressure reading may have completely different health risks depending on their body and lifestyle. In today's speech, we're going to uncover what modern research actually says about blood pressure in older adults, why extremely low numbers are not always better, the warning signs many people ignore, and the everyday habits that quietly raise blood pressure without you noticing. Most importantly, we'll discuss how to find a blood pressure range that supports not just a longer life, but a stronger, safer, and more energetic one. Because sometimes the goal is not simply lowering blood pressure, it's protecting the brain, heart, kidneys, balance, and independence at the same time. And before this speech ends, you may completely rethink what healthy blood pressure really means after 60. For many people, blood pressure has always seemed simple. The lower the number, the healthier you are. But once the body begins to age, things become far more complicated. What is considered normal for a younger adult may not always be ideal for someone in their 60s, 70s, or beyond. As we grow older, our blood vessels naturally become stiffer and less flexible. The heart must work harder to push blood through arteries that are no longer as elastic as they once were. This means blood pressure often rises gradually with age, even in people who eat well and stay active. That does not mean high blood pressure should be ignored, but it does mean the body changes in ways that doctors must carefully consider before deciding on treatment goals. One of the biggest mistakes older adults make is believing there is one perfect blood pressure number for everyone. In reality, a healthy and active 65-year-old may tolerate lower blood pressure very well, while a frail 85-year-old will. With balance, problems may become dizzy or weak if blood pressure drops too much. This is why modern medicine is moving away from a one-size-fits-all approach. Doctors now pay closer attention not only to the numbers on the blood pressure monitor, but also to how the person actually feels and functions in daily life. Another important issue is that many older adults experience sudden blood pressure drops when standing up. This condition, known as orthostatic hypotension, can lead to lightheadedness, blurred vision, falls, and even fainting. Sometimes aggressive treatment of high blood pressure accidentally creates new problems that may be just as dangerous as hypertension itself. A person may proudly achieve very low readings while silently increasing the risk of injury or reduced blood flow to vital organs like the brain and kidneys. Researchers have also discovered that blood pressure naturally changes throughout the day. Stress, poor sleep, dehydration, pain, anxiety, caffeine, and even loneliness can influence readings. This is why a single measurement in a clinic does not always tell the full story. Older adults often need repeated measurements taken calmly at home to understand their true average blood pressure. The goal after 60 is not simply chasing the lowest possible number. The real goal is maintaining a blood pressure range that protects the heart, preserves brain function, supports kidney health, and allows the body to remain stable, energetic, and independent for as long as possible. Many older adults spend years worrying about high blood pressure, but very few realize that blood pressure can also become dangerously low. In fact, some of the most serious health problems after 60 happen not because blood pressure is too high, but because it swings too far in either direction. The body depends on stable circulation to deliver oxygen and nutrients to the brain, heart, kidneys, and muscles. When pressure rises too high for too long, it quietly damages blood vessels from the inside. But when pressure drops too low, the body may suddenly struggle to supply enough blood to vital organs, especially during standing, walking, or physical activity. High blood pressure is often called the silent killer because most people feel completely normal while damage slowly builds over time. Arteries become harder and narrower, forcing the heart to work harder with every beat. This increases the risk of heart attacks, strokes, kidney disease, and vision problems. In older adults, uncontrolled hypertension may also affect memory and cognitive function because tiny blood vessels inside the brain become damaged after years of excessive pressure. Some people only discover they have high blood pressure after experiencing a medical emergency, which is why regular monitoring becomes increasingly important with age. But low blood pressure can create a different set of dangers that many people never expect. When blood pressure falls too much, blood flow too. The brain may temporarily decrease. This can cause dizziness, weakness, blurred vision, confusion, fatigue, and loss of balance. For older adults, even a brief moment of lightheadedness can lead to a dangerous fall, broken bones, or hospitalization. Some people wake up feeling exhausted or mentally foggy without realizing their medications may be lowering their blood pressure too aggressively overnight. One of the most concerning issues is that symptoms are not always obvious. Some older adults adapt slowly to chronic fatigue or dizziness and begin believing these feelings are simply part of aging. In reality, their blood pressure may not be properly balanced. Others experience dramatic fluctuations where blood pressure rises very high during stress or anxiety, then drops sharply after medication, meals, or standing up too quickly. These unstable changes place extra stress on the heart and circulation system. Dehydration also becomes a major factor later in life. As people age, sensation of thirst weakens, making it easier to become dehydrated without noticing. Even mild dehydration can lower blood pressure enough to trigger weakness or fainting. Certain medications, especially diuretics and some heart medicines, may increase this risk further. The healthiest blood pressure for older adults is not simply the lowest number possible. The safest range is one that reduces long-term damage while still allowing the brain, heart, and body to receive steady and reliable blood flow throughout the day without causing weakness, falls, or loss of independence. One of the most confusing questions older adults ask is, what should my blood pressure actually be? For years, many people were taught that anything above 120/80 was dangerous. But modern research shows that blood pressure targets after 60 are often more individualized than most people realize. The ideal range is not simply about achieving the lowest possible number. It is about finding a level that protects the heart and brain while still allowing the body to function safely and comfortably every day. For many healthy older adults, a systolic blood pressure somewhere around 120/130 may provide strong protection against strokes and heart disease. However, not every person over 60 benefits from aggressive lowering. Some people feel perfectly well with readings slightly higher than that, especially if lowering the numbers further causes dizziness, weakness, fatigue, or instability. Doctors now recognize that quality of life matters just as much as the numbers themselves. A blood pressure reading that looks excellent on paper may not actually be healthy if it causes someone to lose balance, become confused, or feel exhausted all day. This is especially important because aging changes how the body regulates circulation. Blood vessels become stiffer over time, and the nervous system reacts more slowly to sudden position changes. That means older adults are more likely to experience drops in blood pressure when standing up quickly, after eating large meals, or during dehydration. In these situations, overly aggressive blood pressure treatment can sometimes increase the risk of falls and injuries. A broken hip or head injury from fainting may become more dangerous than moderately elevated blood pressure itself. Another important factor is overall health status. A physically active 65-year-old with good kidney function and strong mobility may safely tolerate lower blood pressure targets. But an older adult with frailty, memory problems, diabetes, or multiple medications may require a more cautious approach. Doctors often look at the entire person rather than focusing on a single number. They consider energy levels, walking stability, kidney health, medications, and daily function before deciding whether blood pressure goals should be adjusted. Researchers have also learned that consistency matters more than occasional perfect readings. Some people become anxious when see hacking their blood pressure, causing temporary spikes. Others have normal readings at the clinic, but elevated blood pressure throughout the rest of the day. This is why home monitoring often gives a more accurate picture of true blood pressure patterns. Measuring at the same time each day, while calm and seated properly, provides far more useful information than random checks during stressful moments. The best blood pressure range for older adults is one that lowers the risk of stroke, heart disease, and organ damage while still preserving strength, balance, mental clarity, and independence. The healthiest number is not always the body and brain to function safely, steadily, and confidently throughout everyday life. One of the biggest misconceptions about blood pressure is the belief that the body will always give clear warning signs when something is wrong. Many older adults assume they would immediately notice if their blood pressure became dangerously high, but the truth is that hypertension often develops silently over many years. A person may feel completely normal while damage slowly affects the heart, arteries, kidneys, eyes, and brain. This is why high blood pressure is often discovered only after a stroke, heart attack, or serious medical emergency has already occurred. Some people believe headaches, sweating, nervousness, or facial flushing always indicate high blood pressure, but these symptoms are unreliable. Stress, lack of sleep, dehydration, anxiety, and many other everyday factors can cause similar feelings. In fact, many individuals with severely elevated blood pressure report no symptoms at all. That silence can create a false sense of security. Someone may avoid regular monitoring simply because they feel fine, unaware that years of uncontrolled pressure are weakening blood vessels little by little. At the same time, symptoms from low blood pressure are often misunderstood or dismissed as normal AGI. Older adults may experience fatigue, dizziness, unsteadiness, blurry vision, brain fog, or weakness and assume these changes are simply part of getting older. In reality, these problems may be signs that blood pressure is dropping too low, especially after taking medications, standing up quickly, or becoming dehydrated. Because the brain is highly sensitive to blood flow changes, even temporary drops in pressure can affect concentration, balance, and energy levels. Another reason symptoms can be misleading is that blood pressure naturally changes throughout the day. It may rise during emotional stress, pain, physical activity, or poor sleep and then fall later during rest or after meals. Some older adults experience large swings between high and low readings within the same day. They may feel normal during one moment and suddenly weak or lightheaded the next. These fluctuations are common but often go unnoticed unless blood pressure is checked regularly and correctly. Anxiety during in-doctor visits can also create confusion. Many people experience what is known as white coat hypertension, where blood pressure rises temporarily in medical settings because of nervousness. Others have the opposite problem, showing normal readings in the clinic while blood pressure remains elevated at home during daily life. This is why home monitoring has become so important. It helps reveal patterns that a single office reading may completely miss. Older adults should also understand that relying only on symptoms may delay treatment for serious conditions. Waiting until headaches, chest pain, or dizziness appear may mean damage has already progressed. Regular monitoring provides information long before the body begins sending warning signals. The most dangerous thing about blood pressure is that the body does not always speak loudly when problems begin. Sometimes the only reliable way to protect the heart, brain, and circulation is by checking blood pressure consistently, undetected, understanding the patterns over time, and recognizing that feeling normal does not always mean everything inside the body is truly healthy. Many older adults believe they are managing their blood pressure correctly, but small everyday mistakes can quietly make blood pressure harder to control or even create new health problems. These mistakes are often so common that people repeat them for years without realizing how much they affect the heart, brain, and circulation. In many cases, the problem is not simply the blood pressure itself, it is the habits surrounding medications, monitoring, hydration, sleep, and daily routines. One of the most common mistakes is checking blood pressure incorrectly. Many people measure it immediately after walking, climbing stairs, drinking coffee, smoking, or feeling stressed. Others talk during the measurement or sit with poor posture. These factors can temporarily raise readings and create unnecessary anxiety. Some older adults panic after seeing one elevated number and assume something dangerous is happening, even though blood pressure naturally changes throughout the day. Accurate readings require sitting calmly for several minutes with feet flat on the floor and the arms supported at heart level. Another major mistake is inconsistency with medications. Some people skip doses because they feel fine, while others double doses after seeing a high reading. Both habits can be dangerous. Blood pressure medications work best when taken consistently as prescribed. Suddenly stopping medications may cause sharp spikes in pressure, increasing the risk of strokes or heart problems. On the other hand, taking extra medication without medical guidance can lower blood pressure too aggressively and lead to dizziness, falls, or fainting. Dehydration is another hidden issue that becomes more common with age. Many older adults drink less water because their sense of thirst weakens over time, or because they are trying to avoid frequent trips to the bathroom. But dehydration thickens the blood and can destabilize blood pressure, especially when combined with certain medications. Some people become weak or lightheaded simply because they are not drinking enough fluids during the day. Poor sleep is another overlooked factor. Sleep apnea, frequent nighttime waking, and chronic sleep deprivation place enormous stress on the cardiovascular system. Even people who eat healthy foods and exercise regularly may struggle with blood pressure control if their sleep quality is poor. Stress and loneliness also play a powerful role. Chronic emotional stress keeps the nervous system activated, causing blood vessels to tighten and blood pressure to rise over time. Dietary habits matter as well, but not always in obvious ways. Many processed foods contain extremely high sodium levels even when they do not taste salty. Restaurant meals, canned soups, sauces, frozen foods, and packaged snacks can quietly push blood pressure higher day after day. At the same time, some older adults restrict salt too severely while taking medications that already lower blood pressure, which may increase weakness or dizziness. The biggest mistake of all may be assuming blood pressure management is only about numbers. True blood pressure health involves balance, consistency, hydration, sleep, movement, stress control, and careful monitoring. Small daily habits repeated over months and years often influence blood pressure far more than people realize, and correcting these habits may dramatically improve both long-term health and everyday quality of life. Many older adults assume that controlling blood pressure depends entirely on medication, but daily lifestyle habits often have a powerful effect on circulation, heart health, and blood vessel function. In fact, some of the simplest natural strategies may help stabilize blood pressure, improve energy levels, and reduce stress on the cardiovascular system without extreme diets or exhausting exercise routines. The key is consistency. Small habits repeated every day can gradually create major changes inside the body over time. One of the most effective natural tools for healthy blood pressure is regular walking. The body was designed to move, and physical activity helps blood vessels remain flexible and responsive. Even a gentle daily walk improves circulation, supports heart function, reduces stress hormones, and helps the body use oxygen more efficiently. Older adults do not need intense workouts to benefit. In many cases, steady movement for 20 to 30 minutes most days of the week may provide meaningful improvements in blood pressure control while also supporting balance, mood, and joint health. Sleep also plays a much larger role than many people realize. During deep sleep, the nervous system resets and blood pressure naturally falls for several hours, giving the heart and blood vessels time to recover. But poor sleep, frequent nighttime waking, and conditions like sleep apnea can keep stress hormones elevated throughout the night. Over time, this constant strain may contribute to stubborn high blood pressure even in people who appear otherwise healthy. Improving sleep quality by maintaining a regular sleep schedule, reducing late-night screen exposure, and creating a calm bedtime routine may help stabilize blood pressure naturally. Hydration is another overlooked factor. As people age, the sense of thirst often weakens, making dehydration more common. When the body lacks enough fluids, circulation becomes less efficient and blood pressure may fluctuate unpredictably. Drinking enough water throughout the day helps support stable blood flow and may reduce dizziness, fatigue, and weakness, especially in older adults taking blood pressure medications. Stress management is equally important. Chronic stress keeps the body in a constant fight or flight state, causing blood vessels to tighten and the heart to work harder. Over time, this raises blood pressure, and increases strain on the cardiovascular system. Relaxation techniques such as deep breathing, prayer, meditation, gardening, social connection, and spending time outdoors may help calm the nervous system and improve overall cardiovascular balance. Dietary habits also make a major difference. Foods rich in potassium, fiber, healthy fats, and antioxidants support blood vessel health and reduce inflammation. Fruits, vegetables, beans, nuts, olive oil, fish, and whole grains may all contribute to healthier blood pressure over time. At the same time, reducing heavily processed foods, excessive sodium, sugary drinks, and excessive alcohol may prevent unnecessary strain on the heart and circulation. Natural blood pressure support is not about chasing perfection. It is about building daily routines that help the body function more efficiently, reduce stress on the heart, and preserve strength, stability, and independence for as many years as possible. Hashtag final conclusion blood pressure. Your after 60 is not just about hitting a perfect number on a machine. It is about protecting the organs that allow us to live independently, think clearly, move safely, and enjoy everyday life. For many years, people believed lower was always better, but we now understand that the healthiest blood pressure for older adults is one that keeps the heart, brain, kidneys, and circulation working together in balance. Numbers alone never tell the full story. Throughout this speech, we explored how aging naturally changes the blood vessels, why blood pressure that is too low can sometimes be just as dangerous as blood pressure that is too high, and how symptoms are often misleading or completely absent. We discussed the common mistakes many older adults unknowingly make, from improper monitoring to dehydration, poor sleep, stress, and inconsistent medication habits. Most importantly, we learned that healthy blood pressure management is not only about medication. Daily movement, better sleep, hydration, nutrition, emotional well-being, and consistent routines all play powerful roles in supporting long-term cardiovascular health. The goal is not to become obsessed with numbers or live in fear every time the blood pressure monitor changes slightly. Blood pressure naturally fluctuates throughout the day. What matters most is the overall pattern, how the body feels, and whether circulation is supporting strength, balance, mental clarity, and quality of life. A healthy blood pressure plan should help older adults remain energetic, stable, confident, and independent, not weak, dizzy, or constantly anxious. Aging does not mean losing control over health. In many cases, small, consistent choices create the greatest protection over time. A daily walk, better sleep, drinking enough water, reducing stress, eating more whole foods, and staying connected socially may quietly improve blood pressure more than people expect. These habits support not only a longer life, but a better life. Because the real purpose of controlling blood pressure is not simply adding years to life, it is protecting the ability to fully live those years with strength, clarity, mobility, and